Sorry, sir. 1 minute.
Right.
Sir, we are in live, sir.
Yes. Good evening, all my seniors and friends. Welcome to you all for this every month webinar. Today, this month, we have selected webinar and panel discussion for sexual challenges in sexual practice. This is jointly organized by CSEP and IMA Initiative for Sexual Health. So both organizations welcomes you all. Now let us welcome with flower bouquet to Dr. Sivakumar Uttare, who is President Maharashtra Medical Council and Professor in HOD Department of Surgery, Grand Medical College and JJ Hospitals. And he is a laparoscopic surgeon and a past President IMA Maharashtra. He is a past chairman A.K. Sinha Institute of Medical Sciences and Research. We welcome you, sir. We welcome you. Thank you very much, sir.
Thank you.
Now let us welcome our chairperson, CSEPI, Dr. Sanjay Deshpande. He is professor in HOD, PSM. At the same time, he is a practitioner. He is the very few doctors who are practicing exclusively sexology in India. Is one such person. Presently, he is holding the post of chairperson CSEP and president Indian Medical Association Nagpur way back in 14 and 15. And he is a sex educator and he is running a clinic on counseling and sex education at Ramdas Pet, Nagpur. We welcome you, sir, with a flower bouquet. Thank you for accepting us.
Thank you.
Now let us welcome our chairman, IMA Initiative of Sexual Health, Dr. M. Balasubramaniam from Chennai. He is IMA President, Tamil Nadu, and he is head for PPLSS IMA, and he is our fellow CSCPI, and a very friendly person. And he is a boon for IMA to becoming a chairperson for the Initiative of Sexual Health. And under his leadership, now a lot of programs are coming. One such program is today's one. So it's a panel discussion on the challenges on sexual health practice. We welcome you, sir, with flower bouquet. Thank you for accepting our invitation, sir. Now, I request the chairman, CSCPI, Dr. Sanjay Deshpande, to say a few words about this webinar.
Yeah. Thank you, Venkat. Thank you for organizing this webinar on a very important topic. I welcome all the delegates who are attending this webinar in a large number. I welcome at the outset, I must say that despite his very busy schedule, our president of Maharashtra Medical Council, Dr. Shivakumar Utture, has been very kind to accept our invitation for being the chief guest of this function. I welcome you, sir, for this CACPI webinar. I know you never say no to our request, and we are really honored by your gesture, kind gesture. So thank you very much for joining this. I welcome Dr. R.P. Singh, Dr. Bala Subramaniam, who is the chairman of IMA Initiative for Sexual Health, and I am also with him working in this. And Dr. Bala is so friendly, so jolly, that whatever you say, he will definitely accept and start doing work on it. And presently, he is working on this fellowship and certificate course on sexology. So we are very fortunate that Dr. Bala is heading this initiative on sexual health by the IMA headquarters. I'm very, very thankful to our IMA National President, Dr. Jayalal, and our Honorary Secretary General, Dr. Jayesh Lele, to whom we will definitely wish to be our guest of honors and chief guest in next monthly webinars. So with this, I welcome all the faculties, the foreign faculties, Dr. Christopher, Dr. Shalini, and Dr. T.S.S. Rao, I place on the record my sincere thanks to Hetero Healthcare, through which we have organized this program. So once again, welcome you all. Thank you very much.
Thank you, Sanjay. Thank you for your message. Now I request our chairman, IMA Initiative for Sexual Health, Dr. Balasubramaniam, to say a few words about this webinar.
Thank you, Dr. Venkatramana. It's it's a pleasure to join IMA Initiative for Sexual Health and in cooperation with the Csepi. In fact, this program actually we wanted to start in the last week of January itself. So I thank Dr. Venkatramana for starting now in things, and we hope to meet the our fellow IMA members and the Csepi members periodically, almost every month. And it's a pleasure to see Dr. Utre, with whom I had worked in GFATM RNTCP at the IMA headquarters, and he is the future IMA leader in the headquarters. It's a pleasure to see Dr. Utre and Dr. R.P. Singh is also a senior member, and we thank both Utre and R.P. Singh for joining today as the chief guest and guest of honor. So I feel Dr. Venkatramana will be organizing similar webinars periodically in the various topics, and he will rope in many of the speakers, international speakers, reputed speakers to our forum and benefiting our members. All the best to Dr. Venkatramana, sir.
Thank you, sir. Thank you for your kind gesture. Thank you, sir. Now I request our President, Maharashtra Medical Council, Dr. Sivakumar Uttare, to deliver his keynote address.
Yeah, thank you very much, Dr. Venkatramana. And of course, my very, very dear and close friend, Sanjay. And I think I'm seeing him after a very long time, whom we call lovingly Bala in IMA. So it's great to see you, if not face to face, at least on the online. See you after a long time. And you know, a few days back when Sanjay gave me a call and say, I'm inviting you for to come for this session of yours, I was wondering that maybe he's calling me because I'm entering the age where I may require the help of some of you all. So, because I didn't know, I would be like a fish out of water amongst all you great personalities who have done so much work in this field. Because as I remember, this is one field which we were never ever taught anything in detail when we were in our college days.
Yes, sir. Yes, sir.
But now it has really gained so much of importance. I still remember way back, a few decades back, when I started my practice, we had hardly one or two persons whom we used to call as practicing sexologists, and we used to wonder what they are doing in their clinic sitting over there. But today I think it has progressed so much, and it has become part and parcel of if I'm not mistaken, one of the major mental health aspects also. And all of you all are doing a great job. Then of course Sanjay told me, no, I want you to talk on the introduction of telecommunication, and especially in my field, that is what is happening. I said, now I'm on safe grounds, I can say something. So that is how, and I'm thankful to all of you for having called me today over here. And it's a real pleasure being amongst all of you. And
Share
I
your
wish...
screen, sir.
Pardon?
Share your screen.
I'll just share the screen. Yeah, can you see my screen?
Yes, sir. Make
Yes,
it
sir.
a full screen.
Yes.
Yeah.
Yes, sir.
So
Yes.
basically, what I'll be talking on today is the new teleconsultations which have been allowed by the National Medical Commission, and what exactly you are supposed to do and not supposed to be do as far as what is in the rules and regulations and in the act which has been written over there. So as you know that the board of governors, the telemedicine practice and guidelines that they were launched on 25th of March 2020. And as I say, I always like to see a silver lining in any dark cloud. And one of the silver linings of the COVID problem, where the patients could not come to you and we were not running our clinics, was that the board of governors allowed us officially to practice telemedicine, which at least in India it was not allowed before that. And there are quite a few cases which were there in the courts where the doctors were punished for doing telephonic consultation or telemedicine. But now, of course, it is legal, but you're allowed to do it. But what are you supposed to do and how you are supposed to do? I'll try to correlate it with what your exact practice is or what I believe you all will be doing in your practice as far as telemedicine is concerned. So, what is telemedicine? Telemedicine is nothing but what you examine a patient when he walks into your clinic and you sit face to face. You are just seeing the patient across a telescreen which you are doing. So it can be either the screen or it can be the telephone. So there are different methodologies. But when you examine a patient and you treat this patient who's at a distance from you, that is what is called as teleconsultation. And there's a huge advantage as far as telemedicine is concerned. Basically, the accessibility and the affordability. Now today, if I want to, I am in Mumbai. Of course, there are a lot of sexologists over here, but suppose I'm in a small town where I do not have anybody there. I can always, online, one of you, I can come online with you and take your consultation. So accessibility and affordability has become very fast. Then, of course, not only that, a lot of cost and effort is saved, because especially for the rural patients, they don't have to travel to any big town or city to meet any of these consultants. It reduces the burden on secondary hospitals, because obviously you can sit at home, the patient is at home, and they do not come, especially during these COVID times. They do not come and crowd your OPDs. Then we are, as per law, we are supposed to keep a lot of documentations, and in telemedicine, of course, it is very easy to keep these documentations. And when that happens, there is always a legal protection to you, because then everything is documented online, especially when you're doing telemedicine through some platform. And then, of course, patient safety is also there, because the patient has got everything online, everything in writing that the patient gets. So improved accessibility, cost efficiencies, improved quality, and patient demand. These are the basic benefits of telemedicine. Now, what is, as far as how do we telehealth and therapy and sexology, how can we really see to this? So what it does is basically therapy can be more private. See, a lot of patients don't want to sit in your clinic, and especially when in the waiting room and then another patient walks in, it becomes very difficult, especially in Indian scenario for the patient. So here you have a patient who's sitting at home. He's not meeting any other patient. Nobody can see what he's talking to you. And then, of course, he can directly talk with his doctor, whatever his private problems are. Then, of course, as I have already said, the geographical boundaries are completely eliminated. So patients don't have to actually physically come traveling all the way to meet you in your clinic. It's a win-win situation, both for the patient and, of course, the treating doctor. The therapy takes place in a more natural setting. We always were taught in our formative days that if the patient is comfortable, the patient will give you a better history, and therefore you can treat the patient much better. So we always find that when the patient is sitting at home, instead of coming into a foreign environment like your clinic, the patient is much more comfortable, so he can talk very easily about his problems. So you know what the exact problems are and you can treat him accordingly. And then, of course, as we talk in sports, especially in cricket, there's always the home advantage is always there. So when the patient talks, he always, the empowerment of the patient is there. And that is what we talk nowadays, that up till now, it was the doctors who were empowered, but the time has come for us because the doctor-patient relationships are changing. So it is high time the patient is empowered. And when he is talking from his home, you're giving him that home field advantage, which goes a long way, especially I feel in any, not only in your field, but any psychological problems. It's a big advantage for the patients. So then of course, the main thing is that many a times you ask both the husband and wife, or the partners as we say nowadays, to come and meet you. Maybe both of them are working, it is not possible for them to take out time and come together. So here you are, under telemedicine, you can get them both. They may be sitting in two different places, they must be in two different towns, but yet you can have a joint consultation with them, which is extremely important. So basically, I feel there are huge advantages, especially in your field, as far as telehealth is concerned. But having said that, you're supposed to, when you do because nowadays many of my colleagues, they say, oh, I have started doing telemedicine. But then I ask them, what exactly are you doing? Then they say, oh, nothing. I just pick up the phone, talk to the patient on WhatsApp. I talk with the patient. But no, you're not supposed to do that. Ultimately, you're supposed to see that you follow all the rules and regulations, and these rules and regulations have already been notified. So you better go through all these rules and regulations, so that tomorrow you are not caught on the wrong foot whenever you are doing any teleconsultations. So as far advantage is that any part of India you can do it, but at the same time you're supposed to uphold the same professional and ethical norms and standards as are applicable to standard traditional in-person care that you are giving today. And then of course, for 3 years they have allowed you to directly do teleconsultations, but within the next 3 years you're supposed they will be notifying a course, online course in telemedicine, and you're supposed to pass this course. Only when you pass this course, you will be allowed to continue practicing telemedicine legally and officially. So that you have to keep in mind, that within the next 3 years, you are supposed to do the mandatory online course, which will be notified by NMC. Then, of course, what are the different modes, as we already spoke? It's not just picking up the phone and talking. So it can be video, audio, or text based. It can be an emergency consultation, but that has to be only as a first aid, or it can be a follow-up consultation. And then, of course, the 1.4.2.4, I don't know how far it will be in your field, because it's a very private conversation between the patient and you. But then as far as telemedicine is concerned, it can be between patient RMP, it can be between a caregiver and an RMP, it can be between an RMP who is treating the patient, who wants to take consultation of a senior physician, or it can be a health worker in that area. Now the new concept of health workers is coming up as per the government norms. He can take your help. Then one thing you have to remember is that even what drugs you can give when you're doing teleconsultation has been notified. You cannot go beyond that. And there are these, I'm not going to go into these details, but then they are divided into how you do teleconsultations. Is it your first consultation, or it is a repeat consultation? Are you doing a video consultation or not? And have you examined the patient before physically and then doing teleconsultation? Accordingly, you have to see what is written in these lists, and only give these drugs which are written in the list. And the last line, if you see over here, you cannot prescribe habit forming, narcotic and psychotropic drugs as far as teleconsultation is concerned. But of course, after this notification, there is another amendment in which a few psychotropic drugs are allowed as far as teleconsultation is concerned. So this is nothing new. This is there on the website. I think you can go into details. I won't go into details as far as this is concerned, because this is more for the physicians, when and what they can do, especially when you're treating diabetes, hypertension, which also in your field you see. So how and what type of drugs you can give is all mentioned over here, and you are supposed to follow these norms. So please go through all these lists, list O, list A, list B, all are there in this appendix 5 of the code of conduct. Then of course it should, as far as teleconsultation is concerned, the first thing that it is there, that you have to use your professional judgment if you can continue doing teleconsultation for the good of the patient. Not only that, when you initiate the teleconsultation, identification both of the RMP and the patient is most important. And what I tell my all my colleagues is, as far as the patient is concerned, on teleconsultation he may be for the first time. So please see to it that he uploads his Aadhaar card or any other government photo ID, so that you know the patient who is sitting in front of you is the same person with whom you are going to do teleconsultation. It's very, very important. And then, of course, you are also supposed to identify, because all this is being recorded. So you should say, if someone is doing teleconsultation with me, my first sentence would be, hello, I am Dr. Shivkumar Utture and I am a surgeon and I'll be giving you teleconsultation. This should be the first sentence whenever you do that, and this should be recorded. Then, of course, patient consent is also required. But then I don't know how far in your field it would be important. This consent is very much required to be taken in writing if there is an intermediary between you and that patient, like a health worker or another RMP or a caregiver. So there you will have to take a consent. Otherwise, it is deemed to be consent whenever the patient comes online to take your teleconsultations. Then you have to be very, very careful that if you feel, even in your field, that you require to examine the patient, insist on examination of the patient. Not only that, in the other way also, you should not proceed in doing teleconsultation if the patient insists that he wants to come and see you. Don't do that, because again, that is not as per the ethics. Then what about the prescription? I have already spoken about what and how, which drugs you can prescribe in which conditions. But not only that, even how you issue the prescription is going to be very important. Many of our colleagues are today, writing the name of the drug on WhatsApp and sending it to our patients. Now that is not allowed. That is not allowed at all. You cannot send anything in Word format. It has to be either in a PDF format, or the best way is on your prescription pad. You write down the name of the patient, the details of the patient and the drugs, take a photograph of that and send the photograph to that patient. That is a better way, because they cannot then make any changes in that, or they cannot increase the number of days that the drugs, you also use a lot of psychotropic drugs, so they cannot go on using that, and there is no misuse of those drugs. So the best part is to photo or send a photo or a scan copy or a digital copy, which cannot be tampered with. Not only that, in future, for the future, it is there in the Western countries where you can transmit the your prescription directly to the pharmacy, and the patient just goes to the pharmacy and collects his drugs. Of course, that is still yet not allowed in India, but it may come in the future. But remember, when you're transmitting this, again, you have to take the consent of the patient that you are transmitting this to the pharmacy, and he'll go and collect the drugs over there. So here also consent is extremely important. Then these duties and responsibilities, I think majority of them are the same as is there as we are following in the MCI code of conduct. But one thing I would like to mention over here, that we also will be coming under the provisions of the IT Act, the Data Protection Act and the privacy laws. So that onus is going to be on that doctor to ensure that the name of that patient and his data is going to be not sent to any other pharmacy or to any other entity where it can be used by that entity. And therefore, you have to be very, very careful when you're hiring any services or any platforms on which you want to do. So see the authenticity of that platform. And I tell all my colleagues that ask your association themselves to make this platform, because association will always take care that you are protected and it is not misused by someone else. And then, of course, same thing, confidentiality you have to maintain, and you cannot misuse the patient's images, just like how even today it's there in MCI. But then it is very, very easy to store these images online. So please see to it that, especially the laptop on which you are doing teleconsultation, it is only used by you, nobody else in the family or in your office or anything, because the patient's photographs can be misused in them. And then, as far as the penalties are concerned, it is similar penalties which are there today in the IMC Act, ethics and other whatever prevailing acts like the IT Acts and the data protection privacy laws are concerned. Those are the same ones
Yeah,
which are.
but
Yeah. So then, of course, another important thing, the log records have to be kept. That is a compulsion. And that is why I said, ki, don't try to individually do something unless you're an IT expert. You go onto any platform which has got all these things so that the patient's records are kept properly, the prescription records are maintained properly. My colleagues ask me, then what about my fees? How do I collect my fees? Now, under these consultation rules and regulations, you are allowed to charge fees. Only thing they say that the fees should be appropriate. So what do you mean by appropriate? Basically, appropriate means that you should not be charging more than today what you are charging when you are physically examining the patient, period. It cannot be just because they are on this. It is a much more easier process for you. So charge much less than what you are, or the same as you charge when you are doing a physical examination. Then, of course, collection, you continue with the consultation only when you are satisfied that you have, and give prescription only when you are satisfied and gathered enough of relevant information. If not, please ask them to physically come to you so that you can come to a good diagnosis, and then only give your prescriptions. Uh, as far as the RMP, asking another RMP, I don't know how far that will be important for you, but then radiology, pathology, ophthalmology, all these are allowed for you to interact with them. It is allowed under the Act today, which was not allowed before this. And basically, in emergency situation, as I've already said, it should be the primary care as far as is concerned. You cannot do beyond that. You cannot go on doing telemedicine once the emergency situation is handled. Then, along with the guidelines for the RMPs, there are also guidelines for the platforms also, which have been mentioned over here. And the same guidelines, as I said, the data protection and everything the platform is supposed to do. Not only that, one thing good that they have done is that these technology platforms based on artificial intelligence and machine learning are not allowed to counsel the patient. See, more and more we are especially seeing in pathology, in radiology, that they are using a lot of artificial intelligence, where the doctor is not consulted at all. The x-rays are just go into the artificial intelligence, and then they try to find out what it is, and the machine tells you what is wrong with you. Luckily, in India, at least, they are not allowed to do that. They have to at least come to the doctor with that, and then further take the treatment. Then if that platform is found violating anything, it is blacklisted. Why I have pointed this out is that no RMP then use this platform to provide telemedicine. So whenever you are going on any particular platform, it becomes your duty to see to it that that platform is not blacklisted by the medical councils, so that you continue doing it. Otherwise, again, you will also be held responsible that you have gone onto a platform which has already been blacklisted for violating some of the provisions of these acts. So this is the prescription format which they have given. You may not exactly stick to this. I think it is a little blurred, but you can go onto the website of NMC, and this should be how the prescription format is there. And this can be scanned, or a photocopy can be sent to this patient, where all the details of the patient are there, along with what the chief complaints are, and then what medicines you are going to write with your signature over there. So this is, they have already given a sample for format in Annexure 2 in the NMC Code of Conduct. So basically, do's and don'ts is same what I have already told you. Identification is mandatory. See to it that you only do what is good for the patient. If you feel you cannot come to a diagnosis, refuse to send any prescription to that patient. Identify yourself to that patient also, your registration number, and this should be, it's a compulsion for you to display it, just like it is compulsory to put it on your letterhead today as per the MCA Code of Conducts. Then, of course, the data of the patient, extremely important that you do not leak the data, especially in your field, which is very, very sensitive data. So you must see to it it is not leaked. And then, of course, limitations, you must know what to prescribe, what not to prescribe as per the lists which have been put up on the website. So thank you very much for a patient hearing. I've tried to be as short as possible so that at least I could give you a basic idea of today legally how you can practice teleconsultation in India. Thank you, sir.
Thank you, sir. Thank you, Uttara sir. We thank you very much for your excellent keynote address. We thank you, sir.
Thank you.
Now we'll go to the academics. Today academics is panel discussion on challenges in online sexology practice. As rightly pointed out by Dr. Shivkumar Uttare, the journey of telemedicine in India started way back in 2001 when Indian Space Research Organization started its linking the Chennai Apollo Hospital with Apollo Rural Hospital at Aragonda village. That is the beginning of the telemedicine history in India. From there, it has extended to many colleges and many hospitals and many remote places like Andaman, Nicobar, Lakshadweep, and the hilly areas of Jammu and Kashmir. In 2007 and 8, it has been taken up by a National Medical College Network program where we all contributed by giving our lectures to the students for as a medical education program. Since then, doctors started using this telemedicine as rightly pointed out by giving suggestion in WhatsApp when the smartphones came into use in metros and cities. But a jolt came in 2018 when Mumbai High Court has warned the doctors that you will be liable for the IPC 304A. When a doctor couple from the Ratnagiri district, when they applied for bail, anticipatory bail, the court has observed and given the directions saying that attention doctors, telephone consultation of doctors amounts to culpable negligence, will attract IPC 304A. So this observation was made by the anticipatory bid, as told you, Dr. Deepa and Sanjeev Pavashkar from the Ratnagiri districts. Both were practicing doctors. They were not in the hospital. They were out of station. Their own patient has consulted them, and over the phone, they have given the medicines that has reacted badly, and they lost their patient. And the patient side people have put the criminal charges on them. They approached the court of law for anticipatory bail. Then the High Court observed this and given this verdict. Then the second jolt came when Karnataka Medical Council warned the doctors not to practice online. This is because of the petition filed by the Bangalore Dermatological Society, which filed a petition to the Medical Council asking them to give direction, saying that a lot of advertisements are coming in the newspaper. Tech health services companies inviting doctors to join their panel. So Karnataka Medical Council took it as a serious issue and has warned the doctors saying that our opinion on online consultation hold goods for all specialties. It is not just dermatology. They should not practice. They cautioned all the practitioners registered from Karnataka Medical Council. So when the two jolts came to the medical profession, IMA reacted very sharply on this. Then IMA president, IMA total governing body, approached the medical council on August 8th, 2018, asking the medical council to give the directions or guidelines what to do now in view of the Mumbai High Court observation and Karnataka Medical Council observation. So these are all the statements made by Ravi Vankade. And then medical council started working on it and putting the committees and they're studying how to do. Meanwhile, the corona came into the globe. So when the corona entered India, our beloved Prime Minister called for Janata curfew on 22nd March 2020. Then onwards, first phase of corona lockdown imposed from 25th March. So on phased manner, 4 phases are there, then started releasing the corona. In this corona period, I have observed, as well, you people might have observed also, many patients felt and faced the problems of contacting their family doctors and their specialist doctors for treatment. Many parents and grandparents are panicky about contacting pediatricians for their children and grandchildren. Many pregnant women are worried how to reach their gynecologist because of the weight problems and the nearing time of deliveries. And particularly my specialty or specialty of today's discussion, many patients are tense and cursing the lockdown, not able to meet their doctors to advise and take treatment for condom breakdowns. I used to get calls in the 11:30, 12 o'clock in the night. Doctor, this is what happened, what to do now? So these are all the problems faced by the patients during the lockdown. During this, many patients felt difficulty in getting their medicines by courier as the closed down in the lockdown period, even the couriers also closed. So patients run out of their medicines, particularly HIV medicines, diabetic medicines, hypertensive medicines. Due to phobia and panic reactions, many hospitals also refuse to treat the fever, myalgia, cough cases. So patients they have to face a lot of problems during this period. Some patients held up in other places who have gone on tourism and pilgrimage. There they lost the drugs are exhausted, they suffered with some sickness, they are having very difficulty, no healthcare provider to contact. At the same time, again, my specialty, some people are scared to come to the clinics and hospitals because of this corona fear. They can't reach the healthcare provider to seek their sexual problems. This corona lockdown, as rightly said by silver lining over this the dark cloud, has created an opportunity to resort to telemedicine or online consultation. So this long pending by IMA request, the MCI came out with a provision of legal sanctity for the online consultations that came on the 25th March. Many Indians are turning towards this online consultation for sexual issues. This medium allows people to talk about these issues without inhibitions, at the same time maintaining their privacy. So this came into existence because of Corona. So Corona has done one way a good to the online consultation, or rather has given a legal sanctity for Indian doctors to practice this. So sexology, as we know, but for the sake of definition, is an interdisciplinary scientific study of human sexuality, including behavior, function, and intercourse. A sexologist is a trained professional specializes in the human sexuality. The challenges what we are facing today in online consultation, we will be discussing with our expert panels here, is a patient feel comfortable in discussing the issues in their private sexual life through the phone or sometimes through video call. The fact the patient feels assured that no one is seeing him or her. This is the advantage which already Dr. Uttare has stressed about it. Is how the online consultations will go on, doctor, doctor, patient, doctor. As I told you, 25th of March 2020, this guidelines came, Board of Governors guidelines, which in detail dealt by Dr. Uttare. Ayushman Bharat scheme introduced by our Modi, our Honorable Prime Minister has also stressing this. Indian government today is encouraging the telemedicine for the development of health sector in the country. And MCA has already told by that is formulating a course for to train all the healthcare providers in the country. So all these healthcare providers who are registered with the Medical Council of India has to undergo this training within 3 years. After 3 years, after 2023 or after 2024 onwards, nobody is allowed a telemedicine consultation without getting a certificate from this training course. So this telemedicine can be defined by as WHO as delivery of healthcare services where distance is a problem or a primary factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of diseases and injuries, for research and evaluation, for continuing education of healthcare providers, all in the interest of advancing the health of the individuals and their communities. Some people call it as healing at a distance. Most of the definitions that are holding on this are called in short as a long distance medical consultancy, or reaching the unreached, connecting the unconnected, virtual clinical consultation, are called as e-consultation, or healing from a distance. These are all the various terminology used for online consultation. American Telemedicine Association defines it as a natural evolution of healthcare in the digital world. It is a roadmap as far as India is concerned. It is a roadmap for improved medical care in rural areas. This is a statement given by Niti Aayog chairman. This telemedicine or teleconsultation is of two types, namely synchronous teleconsultation, asynchronous teleconsultation. Synchronous teleconsultation means it's a real-time consultation where you are seeing the patient, talking to the patient, examining the patient. Whereas asynchronous is store and forward. A patient might have sent an email to you, might have given a message to you, might have given a information on WhatsApp. At leisure, you are seeing it and you are responding to that. That is asynchronous. As rightly Uttara has commented on this. So these are 4 types depending upon the individual is. If you are talking to the patient, it is a patient to RMP. If patient's caregiver, say wife or mother or any attendant, he is coming to you online, it's called caregiver to RMP. Or any nurse or any lab person who wants to talk to you regarding that patient, it becomes a health worker to RMP. Or the treating doctor wants much more advanced information from you, it becomes RMP to RMP. This can happen through video, text chat, or audio. So through RMP to RMP, one doctor asking to the other doctor. Say, for example, a doctor treating his patient for sexual matters, he was stuck at somewhere. He wants to take advanced opinion from you and from me. Then he can come consult us. That called teleconsultation, telesexology. So there is a teleradiology, telepathology, teleophthalmology, teledermatology, telesexology. So this telesexology, this is teleradiology, teledermatology, teleophthalmology, telepathology. This is telesexology, where the treating physician is consulting to you for advanced information or advice. My dear friends, always we have to remember that we should not deny the emergency in teleconsultations. Like a physical consultation, we have to oblige, we have to take the call in emergency situations, but it should be restricted only to the first aid, counseling, and facilitating for referral to the needy physician. We cannot deny the emergency. But at the same time, I want to warn you, telemedicine cannot be the answer for all problems. Though it is useful, it's having its own disadvantages. As every coin has 2 sides, there is always doubt that the online consultation might have made our lives easy, but it is also difficult too. So in order to discuss these challenges, now let us welcome the global experts. I welcome this for this panel discussion. Our first panelist, Dr. Shalini Andrews. She is Secretary, British Society of Sexual Medicine, member exam committee of ISA, and she is practicing in London. We welcome you, madam. We welcome you profusely with a round of applause. Then the second panelist, our urologist, our good friend of us, Professor Christopher. He is from Malaysia. He is a fellow in sexual medicine. He is adjunct professor, School of Medicine, Taylor University of Malaysia. He is a consultant urologist and andrologist. We welcome you, sir. Welcome you with great applause. Our another panelist is eminent person, Dr. R.P. Singh, Professor and HOD, Department of DVL, Nagpur Medical College. He is Secretary, Indian Red Cross Society, Nagpur. He is a MCA Inspector and PG Examiner. He is a Chairman, Board of Studies, Maharashtra Medical University, Nasik. We welcome you, Sir Singh Saab, and welcome our ever smiling personality of India, Dr. T.S.S. Rao. He is a Professor and HOD, Department of Psychiatry. He is a well-known figure in India and abroad. And he is editor, Journal of Indian Psychology and Psychiatry, MCA Inspector and PG Examiner. And all the above, he has 223 publications, 7 books to his credit. It's a very, very great achievement, sir. We are all proud of you. We welcome you warmly, sir. So now all these are the panelists we are welcoming. Now let us go to the questions which I received during the Corona lockdown. I am putting before the panel. The questions are, what are the prerequisites for online consultation? We'll go to R.P. Singh first, opening batsman. Singh Saab.
Yes, sir.
Yeah. What are the prerequisites for online consultation in India?
It is as good as the in line that it has to be proper diagnosis, proper discretion, and proper confidence with the patient.
Okay.
That is very important.
Sir.
And as you say, you see, in person is required. Same thing is required with the telecommunication facilities.
Yes, sir. So India, particularly in rural areas, still infrastructure development is needed. So
Yeah,
any
that is the
healthcare
problem.
provider who is practicing online, a good laptop with high-speed internet, uninterrupted connection is needed. Preferably a
Right.
quiet room. And a healthcare provider should have basic knowledge of operatings. So these are all the minimum requirements
Yeah.
that from healthcare provider side to need. So if
And the
you are
same has to
using
be
this,
with the patient also.
same thing. That's what I'm telling. Right? So by using video conference platforms, smartphones, Skype or Zoom or online systems, doctors can connect the patients to diagnose that. Now, what are
As
the
rightly
guidelines
told
in
by
India?
Dr. Utre,
Yeah. What are the
it has
guidelines
to
in
be
India?
same thing as the discretion and the diagnostics has to be proper.
Yes, sir.
If it is not, then it may be a problem.
Yes, sir.
So everything what we are seeing in person has to be followed. And of course, the diagnosis has to be reached upon. Without that, the treatment or consultation should not go ahead. And we can deny at any time if it is not possible.
Yeah, yeah.
And in for that, we can take the opinion of
We'll
other
come
consultants
to that.
like
Now I'll go to
radiology.
the next question.
Yeah, sure.
What's in India? Can anybody give online consultation?
Yeah.
We'll take the opinion of TSS Rao.
Right.
Rao, sir.
No, you asked me the question?
Yes, yes. What are the guidelines in India? Can anybody give online consultation?
I think Dr. Uddre very classically explained what are the developments that happened, and even in your presentation, how precisely things have developed. I think it was very nice that historically all the progress that was made was brought out in very clear terminologies. As psychiatrists, say for example, we have a very specific what we call as operating procedures for teleconsultation in psychiatry.
Yes, sir. Yes, sir.
This is, for example, the Teleconsultation Society of India. In fact, that is one more thing which has been
Yes,
formed.
yes, sir. Yes, sir.
Along with the Indian Psychiatric Society and National Institute of Mental Health and Neurosciences, we have brought this. So, each specialty may be actually developing different type of issues. But the point very clear is actually here there is a person who is trying to provide consultation, who is fully qualified, understands all
Bharat?
Sir.
Bharat?
Sir.
అందరు మ్యూట్ చేసే ఎక్సెప్ట్ స్పీకర్ మై సెల్ఫ్ అండ్ స్పీకర్ మిగతా మ్యూట్ చేసేయండి.
Okay, sir. Yeah.
Yes, sir. Now we proceed.
So we have, for example, starting from Medical Council of India. In fact, the first initial draft came from the Medical Council of India.
Yes, sir.
And of course, we had this National Medical Commission.
Yes,
then
sir.
subsequently, each of the specialty branches, they are trying to come out with very specific operative procedures related to teleconsultation.
Yes, sir. Yes, sir.
The important message what I would like to convey is, as it was brought out earlier, our capability to understand all the issues involved with this newer technology.
Yes, sir.
That way, we are there to provide maybe whatever area. In fact, nearly 5 areas related to sexual medicine, what you were mentioning.
Yes, yes,
One
sir.
area what we can add is actually the research and related aspect also what we can add.
Yes.
There's one more terminology. So, be
They
aware
had-
of what all the issues involved, understand the technology properly. And the third one, from the patient's point of view, every patient can be a litigious issue possible, because now here we are not only exposing, we are documenting a lot of things which can be used for the good or for the bad both.
Yes, sir.
So few of
The
the
Medical Council of India and National Board of Medical Council has given a clear instructions that only allopathic doctors who are registered with the medical councils are eligible to practice online. Other system of medicines like Ayush, Ayurveda, Homeo, Unani, they are not authorized to do online practice.
now
It's the
lot
one,
are happening with the Ayush and other related things. Whether
yes.
any such this thing, I think day to day we must keep a watch on what.
Government has clearly given instruction not to practice. We'll go to the next question. What are the advantages of online consultation? We will go to Dr. Shalini.
Yeah, so we moved on to like India, we moved on to online consultation, and we don't have very specific guidance, but we do. All our records are electronic. Advantages: patients don't have to travel, so it's great for them to be in the comfort of their own homes and to be able to do the consultation. Again, for me, getting both partners on the at the end of the phone is quite difficult, and online has made it so much easier in terms of being able to get partners, get everybody engaged within a telephone consultation. Sometimes I think, particularly with the telephone consultation without a video, patients disclose more possibly than they would on a face-to-face consultation. So some of the in-depth things, I find it quite useful.
Yes, madam. Nice. Thank you. Same thing here also for Indian patients. No need not take permission from the office to come to the doctor's clinic early. No waiting time in the clinics. No awkwardness. No chance of any infection by coming to the clinics. No traveling. No waiting. No location boundaries. They can contact any doctor in India from Kashmir to Kanyakumari. No location boundaries. No risk of exposure. So these are all the advantages which we are also facing here, madam. So this online consultation platform has a huge rise in the traffic during this lockdown. And there is a beautiful study done by American scientists, Data Labs Incorporation, saying that India is having a lot of growth in online consultation. So thank you for your expert information, madam. Now we'll go to what are the disadvantages or limitations of online consultation. We'll go to Dr. Christopher.
Okay, thank you. Yes, for online consultation, I think the main disadvantage is that you can't examine the patient. So, yeah, certain things we need to actually examine and to actually come to a diagnosis. So that's why my advice is actually, if it's a first time the patient is seeing you, online consultation is actually not advisable. Online consultation should be used only in patients who who you have already examined and you've got a diagnosis, and you're treating for the same diagnosis, not for something new, because a lot of medical legal issues. And the other thing is that you need to have a very good online system, and the pictures and the photos. Yeah, sometimes you got these sexual transmitted diseases, dermatology, which you can't really see in detail just on the picture on the camera on the phone only. So those are the disadvantages which I think can be have medical illegal implications.
Yes, sir. Same thing we are also in India, sir. Our rural areas infrastructure still has to improve because of that one area. Ignorance and lack of awareness in the rural areas. Rural India lacks the basic infrastructure and language and communication issues, because India is having a lot of languages. It's a difficulty. If I'm sitting in South India, I cannot talk what you call clearly with the North Indian languages. Like this, language and communication barriers. Acceptance for both doctors and patients is a big challenge. So these are all the challenges which are facing, our limitations which we are having here. Restricted at the same time, another important thing for Indian healthcare providers is we have to do online consultation for Indian patients only with Indian doctors. There's a jurisdiction is there. He can, as rightly pointed out by Professor Christopher, we cannot do physical examination. Now we'll go to the next question that are asked to us is, what are the documents to be preserved in online consultation? Already Uttara spoke it, but anyhow we'll listen from RP. Singh Saab. Since Singh is offline, we, the healthcare provider, has to maintain all patient records. including the case history,
Yes.
investigation reports,
Yes.
images, etc. So these are all the things
And
which have
even photo ID.
Yes, sir. Photo IDs. Excellent, sir.
Yeah.
So what are the next question? What are the legal and ethical issues in online consultation? We'll go to TSS Rao. Unmute yourself. Unmute yourself. Yes, sir.
Of course, this is an evolving area, and we ourselves are trying to understand this concept. We have, say, I can take an example of psychiatry. There are few people who are very proficient with all the processes involved, but there are a lot of seniors and many people still find technology, gadgets, and all these type of things quite difficult.
Yes, sir. Yes, sir.
What to store, what not to store, how to operate. Even if a simple webinar is done,
Yes,
I
sir.
think Venkatramana will be very well aware of
Yes,
how
sir.
difficult it would be sometimes to get even the faculty run the show.
Yes, sir.
That is there. Each country may have its own versions, so one should be well aware of where he is practicing, what he is trying to do. That is the second point.
Yes, sir.
Third one, from I can take the example again from psychiatry.
Sir.
In fact, it is more particularly in our branch. What happens? Person may be highly suspicious, and in fact, the lot of advantages what is being mentioned for a lot of other specialists is little different in psychiatry. Here, patient may be suspicious, and even to talk, things are getting documented, and majority of the other related things actually may crop in. So coming to one, of course, ethically speaking, we are trying to follow what are the guidelines that have been given. And within the permissible range, one can definitely go ahead and try to do the things. And few things what have been actually mentioned, confine yourself to the particular speciality. In fact, don't try to be over enthusiastic and try to do, in fact, consultation for a lot many other things. That is one. The guidelines very clearly specifies that whether it is an ethical issue or a legal issue, that the first consultation before you write medicine, a physical consultation is an absolute necessity. So we should be well aware of how much I can speak, how much I can go forward and prescribe and try to manage. So that is one. Well aware of what drugs can be used, what drugs cannot be used, and the issues related to that. Say, for example, over-the-counter drug, that O category, may be absolutely fine, and better to confine oneself to that particular point. And if somebody crosses that particular limit and entering into those, say, for example, category A, they have permitted quite a few medications. But how much to write, what to write, and whether something has been actually properly evaluated by the RMP and all of that, one should be well aware of that particular point.
Yes, sir.
They have permitted, say, for example, a very innocuous looking drug like, say, lorazepam or common drugs what we write. Of course, they have permitted now clonazepam. But when we write, take an example like lorazepam, the law might be telling something here, but there is another law for like Narcotic and Drugs Act. In fact, that will come into the picture, and whether I am trying to do a right thing or wrong thing.
Yes, sir. Yes, sir.
So there are a lot of gray areas.
Yes.
Well
Yes, sir.
prepared, and of course, these are all extremely important point Dr. Venkatramana has already
Yes, sir.
projected. The content which we are trying to do, identification of the RMP and the patient, we are all few of those things.
So this is
Mode
a
of
checklist
communication,
which we have to
consent,
follow.
type of consultation, patient evaluation, patient management. One
At the
should
same
be
time, yeah.
very well.
At the same time, we all should observe that our online treatment or prescription should not be for more than 6 months. After 6 months, again, physical consultation is needed. That is very, very important as far as Indian online guidelines is concerned.
In fact, one of the other point what actually mentioned in our, say something like specialty psychiatry,
Sir.
the earliest possible to visit the doctor.
Doctor, that's always
Advise what should be given.
At the same time, we, the treating physicians or specialists, we should clearly mention the timings of our consultation, our availability, or in our absentia, where to go in emergencies, whom to contact also, it has to be given. It has to be there printed in our letterheads. Every RMP should tell his consultation timings, availability to, or in the absentia, whom to contact in emergencies, etc. That's very, very important.
I can quote one example. So we have this fellowship training program.
Sir.
One of the trainee, in fact, she's a consultant psychiatrist only.
Sir.
One of the case related to the sexual problem and all, and this particular person insisting repeatedly on, I want you to examine and I want to show the private parts and things like that. So yes. These are all type of ethical issues that crop.
Yes. That question is there. That question is there. It's coming. The next question is, what are all the sexual problems that can be handled by online consultation? We'll go to Dr. Shalini.
So all sexual problems can potentially be handled online. So any desire, arousal disorder, orgasmic problems, relationship problems, everything can be handled online. Just a few words of cautions to what cannot be handled online. So one is problems that require examination. So you may be able to see, I don't know the rules in India, we do have ways of looking at genital pictures online. So we can make a diagnosis. So I can look at a vagina and see if there is lichen sclerosis, but I cannot tell the degree of vaginismus. I can't do a speculum examination online. So those situations where you need a proper medical examination, you need a face-to-face. Second thing is issues of domestic violence or partner abuse. So when you have a patient in front of you, you call one person into the room and ask them the questions, and you can call the husband or wife into the room next and ask what's going on. Whereas online, you don't know who's controlling that consultation. So, those are difficulties. So as long as we are mindful of what cannot be done online, online consultation can be used for just about any sexual problem.
So how to use our professional efficiency to judge what to treat online, what not to treat online. So that exercise we have to do. Excellent, madam. Thank you for your contribution. Now I'll go to the next question. Does patient can sue doctor for negligence in online consultation? We'll go to Dr. Christopher.
Yes. I don't know how it is in India, but in Malaysia, yes, they can actually sue for online consultation because according to the lawyers here, according to the legal system here, the online consultation is will be treated similar to a normal consultation in the clinic. So the medical legal implications is there. So you need to take proper precautions and you need to treat it like as though it is a normal clinic consultations.
Yes, sir. Here also same thing. In India also, it is like that only. Negligence, lacuna, misconduct will be always punishable. So what constitutes the misconduct? I have given certain examples which Dr. Uttara also has commented. Thank you, sir. Thank you for your contribution. Now we'll go to next question. Does insurance companies cover for online consultation? We'll go to country. Now we'll go to London first. Dr. Shalini.
We largely work in the national health system. So I'm a government practitioner, so I don't have to worry too much about insurance. But yes, insurance does cover online practice. So all the private insurance companies cover online telephone consultations. Same rules apply for both online and in-person consultation.
What about Christopher, sir, in your country?
Yes, the insurance companies, they do cover as well for all these online consultations.
So now come to India. Let us see our TSS Rahu. What about in India? Unmute yourself. Unmute.
I was trying to collect information whether any insurance company is providing this particular facility. I don't think in India at present any online consultation is covered by any insurance company.
Singh Saab? Dr. R.P. Singh.
Yes, sir. Truly speaking, it is not fully insured, but to some extent they can be.
So it
is looking upon the.
It is a new concept. It just came areas. 1 year back. It is still a gray area.
Right.
Still, it needs improvement. Right now, there is no what you call insurance recovery.
Proper
insurance
cover.
Proper.
proper cover.
For example, TV advertisement by say something like Star Insurance and all like that.
Yes,
You
sir.
can talk to the doctor like that. It is coming on the screen. But I really don't know whether it's consultation or only some inquiries that can be made.
Inquiries.
Insurance company covers those things.
In case of problems with internet, say for example, healthcare provider is now giving online consultation with the patient. Internet problem, connectivity problem has arisen. A resultant telephonic consultation may be of poor quality. What should be done in that context? Of course, this won't happen in London and Malaysia. It happens in India. But let us listen to them. First, we'll go to India. Dr. T.S.S. Rao, sir, you tell me.
Of course, I'm yet to come across any program where there was no disturbance as far as
See, exactly.
some point or other, something or other, in fact, does come.
Yes, sir. What about Shalini?
We definitely need to improve in many of these aspects.
Yeah, UK is not better. In fact, I think India is probably more advanced with online in terms of your patients. About 20 to 30% of my patients do not use online, smartphones, mobile phones, and using all that. So it's still a problem. Yeah, there will always be a role for face-to-face consultation. I don't think that'll go away.
Christopher, sir?
Yes. So if there is any problem with the internet that you can't carry on a proper teleconsultation, then you can actually reschedule again because it's very, very important because it's medical legal. If you give the wrong advice, then you are liable for it.
Yes,
so
sir.
either that, or if it's still very bad because of the situation of where the patient is, the line is very bad, then it's better to advise them to actually come at least once to get a proper consultation, and then later on at least you know what is going on. You are quite confident of the diagnosis, so you know how to treat them later on.
Yes, sir. Thank you, sir. Singh Saab?
Yes, sir. We can ask the patient if it can be transcribed in the mail form or some written form.
Yes, sir.
And accordingly we can, of course, it may be time consuming. It may not be on the spot, but certainly with the written paper or as he says, online.
As rightly pointed out by Dr. Christopher, we should not proceed. Always reschedule it, because if you proceed, we'll be doing misdiagnosis and land up in problems, legalities. That's why always reschedule it. Online consultation, consent taking is needed, Dr. Shalini ji.
Absolutely. So when I start every consultation, I ask them if they're in a private space, if it's okay to proceed, are they willing to talk, and have a very low threshold to actually stop the consultation if you think consent is not complete.
That consent should be from both the sides, from healthcare provider as well as from patient. Anyhow, Uttare has spoken about this. How to protect from cyber cheating, since it involves the fees, money transaction between the doctor and patient. Nowadays, we'll be seeing in the newspapers, doctor lost so much money, doctor lost, money has been withdrawn without a doctor's notice from his account. So we'll be seeing so many things in the paper. Same thing can happen here. How to protect that? We'll go to our R.P. Singh, our finance minister, R.P. Singh.
Sir, in fact, all the precautions what we take otherwise in online transferring of the money, like changing of the passwords, etc. at times, and checking.
So even we have to be very careful.
Checking our bank accounts at time to time, because we don't know when it can happen. So certainly, and of course, as I said initially, the photo ID is very essential. Until without that, one should not go ahead with the money transfer and everything.
From patient side and doctor side, exchanging the passwords, unnecessarily downloading the unauthenticated apps. All these things should be very careful.
One more precaution, Venkat.
Sanjay.
One more precaution can be taken.
Sir.
That the doctor should give the account in which there is a less amount of money. So even if there is a fraud, he will not be cheated.
So
Sanjay must be holding
separate account.
Sanjay must be holding many accounts.
Nice contribution.
Dr. Venkatramana, I just wanted to regarding that consent question came.
Sir.
When somebody is seeking consultation, there is something called as implied consent.
Yes, sir. It's there. I didn't comment on that because Uttara has commented.
But because we are to be safe and be definitive. So
Yes, sir.
take the explicit consent.
It's like this. The law says, or the rules says, if the patient is consulting you, if the patient is consulting the healthcare provider, implied consent is sufficient. If a doctor is, because somebody is asking the doctor, please talk to my daughter, please treat my daughter online, then explicit consent is needed. That
That's
is
why
clear?
actually every time a precaution must be taken,
Yes,
that a call has to be from the patient.
patient. That's always better.
Yes.
Yeah.
So this regarding this cyber crimes area, it's still a gray area. Both patient and doctor has to be very careful.
Right.
Now the next question is, doctor or patient either can refuse or discontinue teleconsultation at any point of time. Again, we'll go to TSS Rao.
Because either the in-person consultation or teleconsultation, patient has all the right to discontinue treatment or consultation anytime. And the same rule applies even for the consultant also.
Yes, sir.
In fact, this is mutual this thing, and if both agree, then only it can happen.
Happen.
But they can
So we have to inform and we can abort or discontinue. The next question posed is, sir, my wife has applied divorce saying I am unfit to her after enjoying sex for 5 years with me. Please give potent certificate online. So now the potent man for this is Dr. Christopher only. We'll go to Christopher.
Okay, this is a very interesting situation. Yeah. So of course, definitely he wants a potent certificate online. We won't be able to produce it for him, of course. This is a little bit difficult to do online because in potency there are a lot of causes for it, including medical illnesses and so on. And definitely, I think if it's the first time he's seeing you, you need to examine him. So seeing him first time online and to give an advice, I think is not very suitable unless you already know him before, you have actually treated him before.
So that's why, yes, sir, exactly what you told. We should be very careful. We should know our limitations in online consultation. We cannot give left and right certificates. So this is a very, very judicious certificate. We will be unnecessarily dragged to the court of law. We will be held up in the entangled in the law. So always insist on physical examination, evaluate physically, then give as per limitations of your specialty. Where as a sexologist, my specialty, as a urologist, his specialty, everybody has to do. So this is one area where we cannot give online practice. We'll go to TSS Rao.
Okay. See here, a proper history both from the patient and from the partner is necessary.
Yes,
because
sir.
he is claiming that I was satisfactorily performing for the last 5 years, may not actually have any valid reason or explanation. So one has a physical history taking, evaluation, and involving both the partners. All these type of issues are extremely important.
That's why physical examination is mandatory here in this situation. We'll go to next question. Sir, my wife is an antidepressant. Since then, she gained weight, lost beauty, neglecting personal hygiene. As a result, I am losing interest in her. Please tell me how to change her. This fellow don't want to change. He wants to change her. So we will go to her only. Dr. Shalini will enlighten us.
So it's very interesting, and the weight gain is something I think all sexologists see often, either from the husband to wife or wife to husband. It's one of those life changes and what happens. And so one thing, first thing I want to first know before anything else happens is a little more about the wife. Does she want to have sex with him? Because if one partner does not want to have sex with the other, you should not proceed. It has to be mutually consensual for mutual pleasure. So if the wife doesn't want to have sex with him for whatever reason, he shouldn't force himself on her. She's depressed, so we need to make sure her psychiatric consultation is okay and that her depression is treated properly and appropriately. With depression, sometimes people lose interest in sex. Sometimes people become more interested in sex, and sometimes the sexual interest stays the same. So we need to see where her interest is. Are the antidepressants contributing to her disinterest in sex is something that needs, so it's a consultation for her only if she is willing.
Willing.
So we need to see, whether the depression is contributing to it. Does she want to have sex, and what is happening with that? And is she, is the weight gain a problem? Again, there are antidepressants which cause weight gain, particularly mirtazapine, and there are ones which don't. So we need to balance weight gain with sexual interest loss. So, it may be one or the other. Again, neglecting personal hygiene, all of that could be a factor. The second important thing is, if she's neglecting her personal hygiene, is she just not interested in sex with him? And what pleasure is she enjoying from that sex will be my main question that I want to ask. So I want to consult both, and I want to actually see if she does she really want to have sex with him? Is he giving her pleasure? Or is he so focused on his own pleasure that he totally neglects her altogether? So it may be sex education for both of them, psychoeducation for both of them to improve their sexual lives. Third most important thing is, for any couple, you have to remember that the only person you can change in any equation is yourself. You can't come and say, you do this, 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 and you become Aishwarya Rai, and then I will have sex with you. And you think, well, you're not exactly, Bachchan. So, I think we need to make this really clear in couple therapy, that when you come for a couple therapy, the person you're trying to change is yourself, not the other person.
So in this clinical scenario also, online consultation is having a limited role. Again, there may be a need for physical consultation with the both partners. Thank you, madam. Thank you for your contribution. Another question. Sir, my husband's genitalia is white, which I am hating. I have lost interest in sex with him. What to do? Second question also same for different patient. My wife's vagina is white. I am not getting mood. Please give treatment. This genitalia, both genitalia. So we will go to genital specialist, our RP Singh. He will guide us. A patient has sent the photographs also. I am sharing the photographs. So this one more photograph, another photograph of another patient. This one photograph which vagina, what he complains as white. So we'll go to RP Singh to take his opinion.
Sir, as such, looking at the photos may not help at totally for proper diagnosis. Of course, at one place it seems to be vitiligo or vitiliginosus. There we can have counseling and education to the patient that it is not something like a disease, but the abnormality of the coloration. And we should involve both the partners, as you earlier also said, it requires a lot of year. And here it seems to be on photo something like warts, which can be treated properly, or else on the frenum area it is whitish.
Yes.
So again, it is vitiliginosus, something like that.
Yes.
And the counseling and education to both the partners is very important, and that may help to some extent, rather to a great extent.
So it is the desire that is
of course,
not coming
medications
because
are
of
there,
the,
and here in right.
Yes.
So
So it
proper
needs
diagnosis, because it may be something like a sclerosis also.
Yes, sir.
In the vaginal discoloration.
So the first fundamental thing is we have to explain to the patient that it's not infectious. It won't transmit other person. Psychologically, don't put brakes there. So it doesn't interfere with your sexual pleasure or sexual performance.
True.
Then that counseling may help to this couple. The next question asked is, sir, madam, my husband is not spending with me. When I ask why he is doing like this, he says that my breast is small, it's not arousing him, hence not interested. Please tell me what to do. We'll go to Dr. Shalini.
Ouch. That's such a cruel thing for a man to say to his wife, is the first thing I would say as a woman. So what I would want here again is couple therapy. I'd like to see the man first, because this is what she thinks he thinks. we
Yes.
don't know what he thinks.
Yes.
And he may not be aroused for lots of reason. It may be related to her. It may be related to, their relationship. They may be fighting all the time. So he's just getting put off. He may have erectile dysfunction. So he's probably trying to avoid her because he's hiding his own problem. He may be interested in somebody of a different gender. And so we need the husband in the, in a consultation to find out why exactly this is happening, whether he concurs with her story of why this is happening. The second thing again is going back to sexual education. So, I can't, in the UK, mainly people marry who they choose to marry. So no one's forced to marry somebody with the wrong breast size or, who's not turned on or whatever. But it can be difficult if parents or somebody else has made the choice of a person for you. So in your mind, you have Aishwarya Rai and what you get is somebody totally different. So it may be re-educating the mind to say what really matters in terms of sexuality, and what you see in the film in Hollywood and Bollywood is not what is reality. So he may need to reframe his idea of arousal.
Exactly.
And what can be aroused. And I would introduce sensate focus because there's so many ways that a couple can arouse each other if they are interested in each other and if they're attracted to each other. And it doesn't have to be based on the breast. And the last thing I'd sort of say is I will really say, do not go and get your breast augmented because this man wants your breast to be different. Next, he doesn't like your vagina. Next, when you had a baby, he doesn't like the size of your abdomen. How much plastic surgery will you do to please somebody? So don't go down that line if you can help it.
Exactly. We should be at the ground level, real life, not a real life. The real life, if we fall into the trap of real life, as rightly said, we have to change the vagina, we have to change the penis, we have to change the abdomen. We cannot change everything. So we should stick to real life situation where we should know how to change the way our lifestyles, our thinking process to stimulate and get interested. We'll go to Dr. T.S.S. Rao, please.
Well, any man who is not spending time with his wife is her husband, actually. That whole enthusiasm that is there before marriage not likely to continue. And I think if I can mention all married women, this is one of the most common complaint what actually they say.
I'm surprised. Yeah, I'm surprised you see that because, all I hear from married women is they're really pleased that the husband doesn't want to spend time with them. They're quite happy.
So different dimensions. So this particular case involves a lot of issues, and I fully agree with Dr. Shalini because it is not one aspect. There are multiple issues involved.
Yes.
Both the people, husband and wife related issues are there, and maybe the sex education is absolutely necessary.
Yes.
More particularly in India, the men are predominantly focused on size of the breasts or the size of the penis, and these are one of the very common this thing in our clientele.
Yes.
This is because again the total lack of what you call the sex education, and that makes them understand highly unrealistic visual and other related things actually they have seen or have been explained.
We'll go to next question. Sir, madam, my husband is forcing me to watch porno with him. Does it good to watch porno together? Please advise. Again, we'll go to Shalini only.
So I want to find out from her what she thinks about pornography. So one of the big problem now is, everybody is telling us how we should live our lives. Pornography has existed forever. You look at Konark, Khajuraho, you look at our ancient temples, and that's pornography. And that's how we learn about sex. That's how it triggers those pleasure zones in our brain, and there's nothing wrong with that. So we need to find out from her what about the pornography makes her uncomfortable. And it is about, it's like, my husband likes to eat idli and sambar every day for breakfast. I want something different. Is it okay? And it's okay. You've got to meet in the middle and find out what agrees with both of you in terms of it may be a particular kinky porn that turns him on that she doesn't like or whatever, but they can meet in the middle as long as nobody's exploited in that process. And as long as it involves adults in the pornography and not children, not underage people, not exploited people, then it's ethical.
Yeah. So it's again having limitations. So we have to counsel them, which is good both for the via media. We have to give a solution for them. Excellent, madam. One patient telephones or make a call in the night saying that his penis is bleeding while doing sex. Whether doctor has to attend or can refuse. RP. Syncs up.
Yes, sir.
In the midnight, the patient has made a call saying that penis is bleeding.
Sir, usually my phone is off in the night because unwanted calls are lot many over there. But
Excellent.
certainly we can educate and tell them how to stop that bleeding, or else attend somewhere emergency services, because the bleeding can be problematic at times.
So
Simple pressure.
we should not deny the emergency.
Yeah, exactly. So we can suggest nearby emergencies, because in the home we can't advise, of course. Treatment may be little active or proactive has to be there. So even cold sponging or pressing it for a time can certainly help. If it is not, certainly he will have to go to some hospital for the proper medication.
So we have to facilitate the referral. After giving first aid, we have to facilitate. Dr. Sanjay, you want to contribute anything?
Yeah. Dr. RP Singh has nicely told about this. I was about to say the same things.
Okay, right. Thank you. Next question posed is, my wife is more interested in anal sex, which I hate. Slowly, I am losing interest in her. Please, again, why I am getting the same questions to Salini only? I don't know. Random. Please guide me to change my wife. Not my wife, my wife's desire. So, Dr.
Yes.
Shalini.
So again, I need the couple in the room now. So this is where you think online consultation can be tricky, because I want to speak to the wife and I want to speak to her alone, only if she's willing to be part of it.
Yeah.
So one thing, is anal sex bad? And that is a question I get asked by couples quite often. A lot of heterosexual couples enjoy anal sex. The man enjoys it, the wife enjoys it. It is not risky sex between a monogamous couple. So it's associated with increased risk of infections like HIV. That's only from an external person. So if it's only two people always having sex with each other, they won't pass on a sexually transmitted infection if both of them don't have it. So anal sex is okay. Anal sex is safe. Anal sex can be pleasurable, but it depends on partner's preference. So don't force anybody to have it if they don't like it. Now, so he says wife is more interested in anal sex. We know that women generally orgasm from the clitoris, sometimes from the vagina. They enjoy vaginal sex. And if she says, is he saying that she only likes anal sex, or if she likes anal sex as part of a wider sexual repertoire? I'd like to speak to the wife. Is she trying to avoid vaginal sex for certain reasons? It could be pain. It could be a vaginal condition. It could be something as simple as contraception. So, she may not be on a good contraceptive. She may not want to have any more children. And she may say, actually, anal sex is safer. It's okay. So I need to find out whether it's her pleasure preference or whether there are other barriers to why she's choosing what she's choosing. And if there are barriers, then we can help them address the gap. And then finally, as a couple coming together, what you do, it's the same thing. Husband likes idli and sambar every morning. I like toast. What do? You have to choose which day you'd have idli and sambar, which day you have toast, and which day you might have a bit of both. So you have to come to a meeting point as a couple somewhere in the middle.
Yes, we have to settle via media. Doctor, I have lost my erection grossly after starting treatment for my benign prostatic hypertrophy. Please restore my sexual life. I have the question is gone here. I like more sex. That is maybe the question. We'll go to Christopher, right person to comment on this. Christopher, sir.
Okay. Yes. Yeah. So patients who have BPH, normally they are quite elderly, and most of the time, even without medications, training because of the treatment. So I believe it's a medical treatment, and this medical treatment would involve either alpha blockers or the 5-alpha reductase inhibitor. And we know that the 5-alpha reductase inhibitor, due to its action on the testosterone, may actually reduce the erectile function. So in this type of patients, what we can do is actually we have this, we can add on the PD5 inhibitors for this patient. And in fact, the new PD5 inhibitor, the low dose daily tadalafil, has been shown to be effective for patients in terms of improving their erection as well as improving their urinary symptoms. for patients with BPH. So in patients, especially if younger patients like those in the 50s or 60s who still want to have sex, and when they do have problems with their medication, what I usually suggest them is actually to try the daily low dose tadalafil. And surprisingly, actually, most of them, I would say about 70-80%, when they come back to me, they're quite satisfied, and they say that there is improvement not only in their erection but also in their urinary symptoms. Of course, it will not reduce, it will not shrink their prostate, but in terms of symptoms, surprisingly, yes, they do improve. This is medical treatment. If they're talking about surgical treatment, that means after they have undergone surgery and they develop erectile dysfunction, then again, PD5 inhibitors can be used, and it's actually been shown to be able to help to improve their sexual function. For those who have not started any surgical treatment for BPH and they are worried about their sexual function, nowadays there are also new modalities, the minimally invasives like Urolith, Resume, and so on.
If it's proven to be hypogonadal,
Quite new, but studies have shown that there is less patients is hypogonadal with BPH. All right. If hypogonadal with BPH, then we will need to actually check his PSA first,
yes, sir.
and ensure that it is not high. If it is high,
This is a real challenge for the physician.
we need to make sure it's not, we do not miss any cancer. If it's not cancer, we have done a biopsy, it's not cancer, then yes, we can actually put the patient, if he's not worried, if he's so if he's not worried about fertility, we can actually.
Yes, sir. So the definitely real challenge treating a hypogonadal with BPH. The next question is, dear doctor, I have breast like ladies, but I am getting erections. Can I marry? Please send the tablets online. Again, Christopher, sir. He's having gynecomastia, but at the same time having erections. He's asking permission that can he marry, and he wants tablets from Malaysia.
Oh, this is a difficult question. Yeah, so he has gynecomastia. We need to investigate to find out what is the cause of his gynecomastia. It sounds like he may actually have this, what do we call it? He may have some genetic disorders where he could be like these syndromes like Klinefelter's and so on. So he needs to be investigated to find out the actual situation. So because he's asking questions like, can I marry and so on, it sounds like that he has doubts about his sexuality, his gender as well. So we need to investigate further in these type of patients and not just
we have to check for obesity, because in obese patients, because of hyperestrogenemia, the gynecomastia will be there. And that may be because of his concern with his body shape, he may be asking this question. We'll go to Dr. T.S.S. Rao. Unmute, sir. Unmute, sir.
Of course, age of the patient may be extremely important to know.
Yes, sir.
Very often it could be absolutely normal physiological one, and that extreme anxiety whether something I'm turning out to be a female, and lot many other such questions these young people may have. So a proper sex education, of course, absolutely necessary. Of course, we can't write medicines for all these type of things. Is a point which has been.
It is risky. We cannot write online.
I think this webinar.
Yes, sir. Next question is, sir, madam, I am obsessed with sexual thoughts almost always. It is affecting my life many ways. Please give medicines online. Right person is Dr. T.S.S. Rao to respond to this.
Of course, it is being said that every man thinks about sex every 5 minutes once.
How many times have you thought?
And correspondingly, of course, a woman may be thinking about sex every half an hour once. This is what actually one of the studies mentioned.
Studies, yes, sir. I too read that.
The issue here is again explaining to him that why this particular whole issue arises. In our country, we have a particular syndrome called as Dhat syndrome and things like that. People try to control oneself, not to think anything about sex. Even dreams they actually attributed something wrong, and any ejaculation, the loss of energy, vitality, to something very vital and all of that. So this may be very much concerned with a lot of myths and misconceptions that particular man carry.
Yes.
We should not straight away jump to the idea that this could be something like obsession and compulsive disorder and things like that. So extremely common, making him understand that more he tries to control, more sexual thoughts are bound to come. So this is one of the important points. Of course, it cannot be treated by medicines, but for sex education.
Yeah, it needs more evaluation and counseling. Next question is, sir, madam, I am having white discharge since long. Gets itching, but off late my husband also itching after sex. Please prescribe medicines online. Dr. Shalini ji.
Yeah, from the story, it sounds very much like she's probably got vulvovaginal candidiasis, and maybe the husband's also getting symptoms from it, but I cannot assume it. Actually, I would like to examine patients because main part of my work is treating sexually transmitted infections. So things like trichomonas can cause similar symptoms. So I would like to see the woman. I would like to do a speculum examination. I'd like to confirm a diagnosis before I treat either of them. And as much as online medication is okay, you can get thrush treatment online. I wouldn't jump. If they've come to a doctor, they better get proper treatment. So I'd like to see them both.
Yeah, exactly. Because many conditions do cause this vaginal discharge. Apart from trichomoniasis, candidiasis, bacterial vaginosis, even a chlamydial, herpetic, there are many conditions which can cause. To differentiate it and give specific treatment, physical examination is very, very useful in this particular clinical scenario.
One more, just a point for this thing, because Shalini is from UK and Christopher from Malaysia. In our country, many women, just like men, they come with the white discharge per vagina. When we absolutely normal physiological, again, making them understand. Of course, in this case, the teaching and other related aspects will give a clue to maybe
pathological. It's a pathological.
Absolutely. You know, my community medicine, if I remember from India, I remember that very often. And I think there's a female equivalent of the Dart syndrome as well, the white discharge.
Yes.
We call this a psychasthenic syndrome at present, and we are initiating a multicentric study on this particular thing from our department.
Sir, I am 35 years male suffering from infertility. My seminal count is 20 millions, motility 30%, 40% morphology. Please give online treatment. So now we'll go to Christopher, sir, for online treatment.
Okay, for this type of patient, I think still again I would like to ask him to do further investigations to check for his testosterone, to look at his scrotum, to look for any varicocele or any other pathology which can cause this a problem of his low semen.
Yes, sir.
So of course we can actually give the common treatment that we usually give for these patients would be like clomiphene. But again, I think we need to be very careful, and we need to actually do further tests to confirm. And this is only just one result. By right, we should have two semen analyses before we commence treatment.
Yes, sir. Exactly. We cannot give straight away online treatment. We have to search for any infection, any varicoceles, any partial obstructions. So that's why physical examination is needed very much. The next question is, sir, due to COVID epidemic, I am working from home. As a result, more time to spend with wife. But due to unrealistic fear, She is not allowing for me for sexual intercourse. Please give tablets to her. Now, her doctor is Dr. Shalini only. We'll go to Dr. Shalini.
Again, I need a history from both of them. So, is it real? Is it a real problem, or is it a imagined problem? And does who is avoiding sex, and what is the reason for avoiding sex? So
And
there could
here
be
it is an unrealistic fear what he claims.
Yeah. So what does she fear? What is his fear? Does she think he's going to have sex? Is sex painful for her? Is she not?
No. Corona epidemic, COVID epidemic.
Oh, because of COVID.
COVID.
Okay. So it is, if this is the true story, then, their household contacts, they're going to get it, not
Yeah.
through sex, but from breathing on each other. Far more, there is corona in the semen, but far more from breathing on each other than from the semen. So, a bit of education around it. Second question is give tablets for her. There is no tablet to easily treat female low desire. So we've tried various things. Flibanserin came in the West, and I don't think it's licensed in India. But again, it's not a particularly effective treatment. Female sexual response is very complicated, and it can be responsive. So they need couple therapy. We need to talk about what's going on. But corona, yes, that if it's purely due to corona, that can be easily sorted with education.
Yeah. We'll take Sanjay's opinion.
Yeah, I think here many times what we found in our society, that the wives, they don't get pleasure out of sex. Maybe because of sexual dysfunction of a husband, maybe because of premature ejaculation or anything else. And another thing, maybe she may not be using any contraceptive, or husband is not keen in using any contraceptive. So those issues also, I think, should be discussed with the wife. Again, what Dr. Shalini says is that consultation with wife is also very important.
Yeah.
So
Now
couple
here,
counseling,
in this
the best.
particular scenario, husband is claiming that because of COVID epidemic, I am working from the home only instead of going to the office. My wife is fearing that all these days I went to the office, I might have contacted COVID that may be transmitted to the wife. That's her fear.
Then we can definitely tell her that if 14 days have been passed,
Yes.
that is very simple then.
Yeah.
If husband is working at home, from home, after 15 days onwards, there is no chance of him having COVID infection.
Infection. That we have to explain to her. Counseling.
Yes.
Yeah. The next question. Doctor, I get pain whenever my penis gets erection. Please give medicine. Penis. Dr. Christopher is the right person here again.
Okay, so penis pain during erection, there are a lot of causes, and I think we need to actually examine also. So things like if the frenulum is too short, frenulum brevia, it can actually, during erection, it can actually stretch it and actually cause the pain. And it's quite simple to resolve this. This will need just a minor surgery just to overcome it. It's a pain for erection would be like if they have a cordy where the penis is actually bent when they have the erection. And again, treatment will be different. There are medical treatments, but the treatment is not very effective. Eventually, if it's very problematic, he may need surgery. So for patients who have pain when there's only when there's erection, unfortunately, I don't think there's any medicine that can be given online. We really need to examine the patient and to come to the diagnosis.
Can it be Peyronie's?
Yes, it can be the Peyronie's disease, the cordy, as I said,
Yes,
due to the bent penis. Yes.
So proper examination is a must.
Must.
Even these hypospadias, epispadias also can be there.
Correct.
That won't produce pain.
No, maybe because of cordy they can produce pain. I think Dr. Christopher can enlighten us.
If they do have hypospadias, they sometimes they do have cordy at the same time, and yes, it can actually cause pain, but not all the time.
Okay.
Doctor, please save me. I am working from home due to COVID issue. Again, COVID. I am having frequent sex with my wife. Now she is harassing me, saying all these days you did only once or twice a week. Now you are doing daily twice. How many girlfriends you are maintained all these days? Now TSS Rao will go to him. Unmute, sir. Unmute.
These statements may look very simplistic to deal with, but the story behind this may be actually a pretty one
Yeah.
or long one.
Very challenging clinical scenario, this one.
But the point is, many of the times the being close, increasing sex, being close, decreasing sex, being close, increasing intimacy, being close, bringing out lot of, in fact, seeing a lot of minor things which they were neglecting earlier as becoming something very big is one of the big story during COVID time.
Yes, sir.
All the varieties of permutation combinations related to this we have with us. So we definitely need to go into again, look into all the details and her concern. See, any person, this particular sudden change and all of that, what she's whether she should really be concerned that particular way or not, and all of that again, one has to go into the individual details.
It needs more elaborate history taking and elaborate counseling is needed here. Now we'll close the session. All the questions which I got from my patients during COVID, I have posed to you, and I thanks.
Just want to ask few questions, which are my own queries. Can I?
Yes.
Yes. My first actually point is that whenever we are consulting online, now is it okay to consult a new patient and prescribe the medicines without physical examination and without necessary investigations?
The first governing rules that released by 25th March 2020 says the first physical consultation should be there, then followed by online and can give up to 6 months. Now that is also liberalized. Now you can straight away give online consultation, provided both are identifying each other, doctor and patient, and if you are using your professional knowledge judiciously.
That is one thing. Another thing is that can we prescribe PDE5 inhibitors to the patient consulting online?
Here in India, it is a gray area, no clear-cut guidelines. In other countries, let us go to Shalini and Christopher. Shalini ji, in your country,
yes, you can absolutely can. So, while I tell them that yes, we need, investigations, I'd like to examine them. All men with erectile dysfunction, I do like to investigate and examine them, but it's absolutely fine to prescribe. I say something like sildenafil. It's really safe. It's really easy. They're locked up at home. Why let them suffer?
Christopher, sir, in your country?
For me, what I'll do is for the first time when he's trying it out, I would like to see him first and then follow up to look for any side effects and complications. Once it's okay, then he's already tried it before, then there's no problem actually to prescribe it online.
Here in India, for online, guidelines are not clear, still gray area.
Yeah. And my third question is that after seeing a patient first time in person, because I get many of my patients who are outside Nagpur, the neighboring MP area and Vidarbha area. So they don't want to come you regularly because of all these COVID situations, because of losing time, losing money in traveling and all, which is the most important advantage of this. So how long we should prescribe them online? Because
up to 6 months.
Because we have already given them like sildenafil or tadalafil or vardenafil, or some people are on some hormonal replacement therapy also. So how long we should give them, or can we ask them to have the necessary investigations at their home and then see them, study them, and then again prescribe them?
The guidelines clearly says up to 6 months you can give online treatment. After that, you have to re-evaluate. Based on the prognosis, you have to re-evaluate and you can proceed.
Okay.
Right?
Okay.
Now, we'll take the question and ask. Bharat, any questions are there from the audience? If no questions are there, to sum up.
Sir, I have sent you few questions to yours, sir.
Yeah, please post them.
Yeah, I already posted, sir, to your.
I am not seeing anything here. Or else you read out one by one.
Sir, I can post it again, sir. Just a minute, sir.
No, I'm
I
unable
can
to
keep
see
it for
here.
everyone.
You read out, no problem. We will respond to that. You read question by question.
Sir, it's difficult for me, sir. So I have posted, sir, already in Zoom
There is
chat.
I
one
can
question,
see it.
Venkat.
Do you want me
On
to
chat,
read them?
there is one question. That is a query from Dr. Sita Lakshmi. What if a client from abroad wants to consult a doctor in India via telemedicine?
Indian rules won't permit.
Yes.
Indian rules are permitting that we have to consult any doctor throughout India only, not beyond India.
Because there are few questions on the chat box. You can just open the chat box, Venkat.
No, I'm unable to open it. You read out.
Okay.
I can,
Anybody?
You can.
Yeah. Please.
Shall I read out?
Yeah, please.
Yes.
Yeah, so query 1 is medical management of ED in general practice. Chris, do you want to say something, or anybody else?
Christopher, please take up this question.
Medical management of ED in general practice.
Okay, so in general practice, if you want to start the whole thing, then it's actually we need to investigate the patient and also to come to the proper diagnosis that it's actually ED that we are handling. So you have to go through the history to find out whether they have any medical problems and so on, and whether it's actually ejaculatory dysfunction as well, whether they have any testosterone deficiency syndrome as well, which may need to be treated. Then of course you need to examine to make sure the penis is normal, the size of the testes, whether it's atrophied and so on. Then based on it, then we may need to do things like to check for the cholesterol levels, the lipid levels, as well as to assess the cardiovascular system, and also if necessary testosterone levels. And from there, if everything is fine, if they have underlying problems, diabetes, hypertension, you need to treat it. If they are smoking, you need to advise them to stop smoking. Lifestyle modifications, you need to ask them to reduce their weight and also lose weight, and to have moderate exercise as well. Then only you jump to medications. And medications, the first line, of course, is the PD5 inhibitors. You have all these sildenafil, the tadalafil, and so on, which you can use. And the only contraindication in these patients, actually, if they are on nitrates. And as I think worldwide, not sure whether India still prescribe nitrates, but I think worldwide the cardiologists are not hardly prescribe nitrates nowadays. It's mainly the antiplatelets. So it's quite safe actually, and it's been shown in studies to be very safe. So those in general practice, you just need to make sure they don't have very bad cardiac failure. Their cardiac system is quite okay. And the second thing, the main contraindication is if they are on nitrates. They cannot take it because they may get hypotension. So that's in general practice. If it doesn't work, most of the time when PD5 does not work, it's because they do not know how to take it. So you need to advise the patients on how to actually take PD5 inhibitors. You need to tell them based on the different pharmacokinetics, whether to take it 1 hour before or 2 hours before, and how long it can last. So, and also the third thing is you need to tell them that they need to have stimulation for it to work, for the nitrous oxide to be produced. So if there's no stimulation, you won't just automatically get an erection. So that's the few causes of failure of PD5 inhibitors. But otherwise, if most of the time, I think 70-80% of the time it works. If it doesn't work, then there are other modalities, which I think then will be, you need to refer to a specialty, probably urology, for things like shockwave, for this injection of prostaglandin and so on. All right.
So for a general practitioner, it is the lifestyle modification first step, controlling the hypertension, diabetes, and cholesterol triglycerides next step. Third, prescribing PDI inhibitors. If they are not responding, checking his testosterone levels. Then, if it not responding beyond that, referring to the specialist. That should be the step-by-step pattern.
Thank
Any
you. That's
next question? Any question?
Yeah. So the next one is from Dr. Om Prakash Sanmani. I can take that quickly and then I'll move on to your question for you. So can tadalafil and sildenafil be used simultaneously, and whether they're useful in females? Tadalafil and sildenafil, sometimes in complicated ED, we do use them simultaneously. So tadalafil can be given as 2.5 or 5 milligrams on a daily dosage, so that it puts back the spontaneity, improves the tone. And then sometimes men need a little bit of sildenafil on top of that to perform, and that's okay. Only thing to be careful of is, especially if you're on antihypertensives, your blood pressure can fall, not to take it with the nitrates. I'll hand over to the team next. And can it be used in women? Sildenafil is not particularly useful in women because women have two different things. We have cerebral arousal down there, up there, and genital arousal down below. And both may not always happen at the same time. So just because a woman's genitals are feeling aroused doesn't mean she feels cerebrally aroused and wants to have sex. Because of that, it's difficult. Rarely there are situations where sildenafil may be useful in women, but it comes into the specialist realm. The situations where I find that useful is in menopausal syndromes where they're struggling with genital arousal, or post-SSRI syndromes, but that is a specialist thing. Refer to your local specialist.
Since the question has come, I want to ask one question for you. What are the offline indications or extra sexual indications of sildenafil citrate?
So the one I know is for the height, that when they get altitude sickness. So that seems to be the one where it's commonly used.
Yes.
Dentists seem to be using it quite a lot. What else do you use it in?
Pulmonary hypertension, and for gynecologists, infertility specialists use more to improve the endometrial vascularity.
Even IUD are also they say sometimes.
Yes. So these are all the other indications where people are using this sildenafil citrate. We'll go to the next question.
So next question is for the Indian team. Thankfully, I don't have to deal with a lot of that. So how are we going to deal with quacks and mixopathy in the future? Is there any mechanism prescribed to have checks and balances for quacks practicing online without any MCI registration? This is from Dr.
Our Sanjay will respond to that.
Yeah.
Because he is holding IMA and CSCPA. He is the right person.
Actually, that is the most gray area in India, because people, many people, they don't find any reason to differentiate between two pathies. Like if somebody is a allopath, like MBBS and modern medicine practitioner, and another person is, say, Ayurvedic practitioner or a homeopathic practitioner or any other Ayush practicing pathies. So the most important thing is educating people is most important here. And as an IMA activist, I can say we are fighting with people, government also. But we know that fighting with government alone may not be helpful. We have to educate people and tell them that mixopathy will be harmful to the general population. That is first thing. Also, we are working on the fact that we are telling these other pathies also that if they start practicing mixopathy, then their own pathies also will not be developed properly in competition with the modern medicine. So these are 3-4 ways to tackle with this issue. But as an individual, we cannot do anything. As an individual, we have to be very perfect in our knowledge about all these problems of our patients. We should improve on our, what you can say, ethics and moral issues, because many times in practicing sexual medicine, you need to have these issues with you. So I think that should be sufficient for this problem right now, because as an individual, we cannot help.
This quacks problem is there throughout the globe.
Yeah.
You go to any country, it is there. But of course, it's more in India, but I have seen in America also.
Yeah.
When I was
at least, it's illegal in some ways here, so it's safer for us. Yeah.
When I was in CDC, there was a hue and cry in the press there. In America also, same problem. Thank you. Now we'll close the session. One more question. Yes.
Yeah, please. One last question, and a quick one, and maybe for Dr. R.P. Singh. I want to know how to take consent from a patient.
R.P.
That's
Singh.
the last question.
Yeah.
How to take consent from patient?
Consent in the sense from telemedicine or
yes.
in general?
It is online consent, telemedicine.
online. So
Yes.
as initially it was discussed that it can be implied or explicit. The patient is coming, there is no need to
Yes.
take consent. If healthcare worker is going to patient for counseling or education, then of course consent is needed, and it has to be in explicit manner.
Yes.
Every aspect, every diagnostic problems or investigations, everything for every aspect, it has to be taken up properly.
Yes.
If the patient himself or herself is coming, there is no need to take something like consult, because he himself or she herself is coming to us.
We can
So
ask
as
the
such,
patient.
consent
We
is
can
not
ask the
needed.
patient to mail a request, giving consent to examine or to give suggestion, or send in WhatsApp. So we have to have some written document to safeguard ourselves as a explicit consent.
In explicit manner, right?
Yes, yes.
Otherwise,
Now,
implied consent is not.
Sanjay wants to share something.
No, I want to ask one more question.
Yes, please.
Like in his keynote address, Dr. Utture said that whenever we are consulting online, we should use a authentic platform,
Yes.
like some website or some app you should use. But is it possible that through WhatsApp, through video calling, we can directly treat our patient online?
Yes, yes. This, in my opinion, treating directly is the safest. No third party is there. No question of leaking the messages, leaking the photographs, leaking the information. We are more safeguarded. If you are using any other platform, then third party will be interfering here. If anything happens without our knowledge, we will be tracked to the court. That happened in many cases.
True.
Right?
Yeah.
Now we close. So to sum up, online consultation is never replaces the traditional consultation. It is an adjuvant to it. Notification of telemedicine guidelines marks the dawn of new era in the practice of modern medicine in India. The law has finally catch up reality and a necessity of the modern times. Telemedicine guidelines enable doctors to confidently provide teleconsultations. Where clinically appropriate, telemedicine is a safe, effective, and a valuable modality to support the patient care. Telemedicine provides patient safety as well as health worker safety, especially in situations where there is a risk of contagious infections like our COVID epidemic. Telemedicine is a win-win situation to the patients, to the doctors, and to the hospitals also. With this, now we close the session. Thank you. I congratulate all the panelists and I thank them for our overseas panelists and our national panelists for contributing their scientific knowledge and expertise in this webinar for enrichment of our Indian healthcare providers. Thank you one and all. Thank you, Shalini. Thank you, Christopher. Thank you, RP Singh. Thank you, TSS.
Thank you very much.
Our
Everybody.
Sanjay. Thank
I would
you
like
and
to have,
everybody.
email IDs of Shalini and Christopher.
Christopher. Yes, sir.
Thank you.
Thank you.
Thank you. Thank you.
Thank you
Our
very much.
special
Thank you,
thanks
thank
to
you.
Dr. Venkatramana.
Yes, sir. Balasubrahmanyam, sir. Thank you.
We thank you and we expect many more useful programs from you.
Many more like this.
Thank
Sir,
you, sir.
every month one program.
Very good. Sir.
Voice, we'll say.
Great.
Right, sir. Thank you. Thank you, Christopher, sir.
Thank
Thank you all. Thank you all. And
Thank you.
thanks to Venkat
Good
for
night.
nice organization.
Thank you, bhai.
Yeah,
Thank you.
certainly.
What about